Good evening, everyone. I'm Rod Wood.
I'm Christy Casciano. Starting a family isn't easy for everyone. More and more women are having a hard time having a baby, and the cost of in vitro fertilization can cost thousands of dollars.
News Channel 9's Jennifer Sanders tonight explains how a new state law next year will force insurance companies to help out.
It's very heartbreaking when you can't have a baby that you want so bad.
For the next few moments, you'll experience life through the lens of Kate Ingram. It's by no coincidence her journey led her to CNY Fertility. To understand why, though, we have to go back to 2016 during her struggle with infertility.
It was just an emotional roller coaster of struggling, and it really creates a rough environment at home, too, because you want this so bad, but you can't be successful.
She got a frozen embryo transfer and started costly medications and treatments. An emotional roller coaster, now filled with even more twists and turns.
Every day you have to give yourself 2 shots in the belly and then 1 in the backside. And plus medications, oral medications, vaginal medications. It's a lot of medications.
Fortunately for Ingram, the cost at CNY Fertility is one of the lowest in the nation. But for most, that procedure can average about $15,000 to $20,000, something many simply can't afford. Currently in New York State, the law does not require coverage for in vitro fertilization or fertility preservation. But starting January 1st, large group healthcare plans that serve more than 100 people must cover 3 cycles of IVF. Dr. Robert Kiltz has been advocating for this coverage for years.
Well, we at CNY Fertility have really been a major push in all of this and going to the legislators for a number of years and trying to talk about this and help them in constructing this, but pushing for it because we think it's important.
Also come January 1st, individual, small, and large group health care plans will be required to cover fertility preservation services like egg and sperm freezing for those whose medical treatment can make them infertile.
Infertility is just another disease that people are suffering from, and at the foundation of life is having children and building a family. And so coverage for infertility services and IVF, I think, is very important for everyone.
Kate Ingram found out just how important on March 16, 2019.
It is an incredible feeling, but still you just feel like this can't be true. Like it's too good to be true because I've been trying so long, and the IVF actually really worked, and it brought us to our baby, our miracle baby.
An emotional journey inspiring her to help others. Ingram now works at CNY Fertility, providing hope and care to other couples.
It's a different kind of a bond when you actually have to work so hard for that baby and give yourself so many shots every day and so many medications, and every uncomfortable moment, every bruise, every needle is totally worth it.
In Syracuse, Jennifer Sanders, News Channel 9.
And we're also told IVF cycles completed before 2020 do not count. And for more information, such as what's covered if you switch plans, visit localsyr.com.